Welcome to the Neurology Live Mind Moments podcast. Tune in to hear leaders in neurology sound off on topics that impact your clinical practice. I'm your host, Marco Meglio, editor with Neurology Live. In this episode, we sat down with Dr. Véronique Miron, the John David Eaton Chair in Multiple Sclerosis Research at the Barlow MS Center in Toronto to discuss the 2025 ACTRIMS Forum, which is held later this month in West Palm Beach, Florida. Miron, a chair of the forum, gives clinical insights on the reasons behind the theme of this year's event of making connections, as well as some of the most notable and innovative sessions that clinicians should keep their eye on. In addition, she speaks on how these sessions align with the most recent MS McDonald Criteria presented in the late 2024 ECTRIMS meeting, expected updates in drug development, and how this year's meeting differs from ones in the past. Let's dive in.
As the MS field is growing bigger and getting more complicated, I felt that it's increasingly important for us to make connections. And this is really on several different levels. So first, between researchers and clinicians as collaborations to advance research, but also between researchers and clinicians and industry in order for us to have clinical advancements. I also think it's really important for us to continue making connections with the MS community to ensure that we are communicating these developments, but also to ensure that with our research and clinical advancements that we are meeting their needs. And so that's the idea behind the theme, and we really wanted to carry that theme forward throughout the scientific sessions in the programs as well. So, for example, we have a session on connecting aging to MS pathology and progression. We're connecting MS to other inflammatory conditions to understand what might be similar between them. We're connecting data from the clinic to understanding MS progression and risk using machine learning. And we've even got some sessions that are more about literal connections, for example, repairing connections and remyelination, and also understanding the importance of different connections within the CNS, but then also from the CNS to other parts of the body and how that influences MS.
So discuss a little bit more about some of the specific sessions from the meeting. What should clinicians who are thinking about attending or who haven't registered yet, what should they keep their eyes on for?
So I'm excited about all of our sessions at the meeting, but I thought there were two sessions that I could highlight that would be of particular interest to clinicians. So the first one is our session that's connecting data to the clinic using machine learning. So this is obviously a very hot topic that we're hearing a lot about, in the media, and this is really a type of AI that uses data to train algorithms in order for us to be able to use large amounts of data and to really generate new hypotheses as to what's going on in MS or how we can better understand the clinical data that we have. And so in this session, we have talks on using machine learning to predict MS progression, looking at profiles of immune cells in MS. And we also have a talk on using machine learning to improve imaging analysis in MS. And I think what's also really exciting is that as part of this session, we have a debate on how machine learning informs on whether we have different subtypes of MS or not, which is a little bit of a controversy right now in the field. Second session is, before I forget, is that we have a late breaking session for the latest research and clinical trial results. So we're going to be hearing about using imaging of paramagnetic rim lesions as a biomarker in the latest phase 3 trials for BTKI inhibitors. We also have a talk on ketogenic diets and how that alters immune cells in MS. And lastly, which is, I think, quite exciting, is that we have a real-world application on the use of the revised McDonald criteria in the clinic.
Obviously, we just mentioned the kind of McDonald criteria. So how do some of the sessions at this meeting align with some of the recent McDonald criteria? Obviously, it very much changes our perception of how we diagnose MS, how we view MS in general. So how do some of the sessions sort of align with those changes and where we're going as a clinical community going forward?
Yeah, so this is a hot topic in the field and very recent, as you've mentioned. This was initially covered at ACTRIMS late in 2024. And we really wanted to, rather than just kind of repeat what clinicians had seen there, was really build on that to provide real world application of the revised criteria in the clinic. And so, as you mentioned, previously the diagnosis of MS was quite rigid actually, and based on evidence of typical clinical attacks and also progression of neurological disability. And now with these revised criteria, we're able to broaden this out a bit using new tools. So for example, incorporating criteria based on MRI imaging and on, for example, immunoglobulin in the cerebrospinal fluid. And so based on broadening that criteria, that means that likely there are individuals that previously wouldn't have met that criteria for a diagnosis that now could meet the definition for MS. And this has really important implications for their treatment. So one talk that I really want to highlight is in our late breaking session, where, as you mentioned, this is kind of a new development. And so we were quite happy to have this be as our part of our late breaking session, is a study that was led out of Cleveland Clinic. That's a multi-center diagnostic biomarker study that was looking at the application of these revised criteria for individuals with atypical presentation or radiological only presentations. And I won't spoil it too much with the results of what I've seen in the abstract, but I think this is going to have a really big impact on how we could now have broader treatment options for individuals that normally would have been excluded from diagnosis based on the old criteria.
We're going to take a quick break from our conversation with Dr. Miron to keep you up to date on the latest developments in neurology. Welcome to the Neurology News Minute. Here's what you may have missed since our last episode. First, on January 30th, the FDA approved Axsome Therapeutics AXS-07 as a new therapy for the acute treatment of migraine with or without aura in adults. Marketed as Symbravo, the oral, rapidly absorbed, multi-mechanistic agent is expected to be commercially available in the United States in approximately 4 months. Next, on the same day, the FDA approved Suzetrigine, an oral selective NaV 1.8 pain signal inhibitor to treat patients with moderate to severe acute pain. Marketed as Jornavax, the novel non-opioid therapy became the first new class of medicine to treat acute pain in over 20 years. And lastly, on February 4th, the FDA approved SPN 830 as the first and only subcutaneous apomorphine infusion device for the treatment of motor fluctuations in adults with advanced Parkinson's disease. Marketed as Anapco, the therapy should become available in the second quarter of 2025. For more information about these stories, head to neurologylive.com, or you can check out the corresponding link in the show notes. And now, back to our conversation with Dr. Miron. It's really awesome that we're able to kind of have these conversations and take a look at the disease from more of a molecular level. Kind of just speaks to the shift of neurology in general over the last 5 to 10 years or so. So obviously you talked about one session specifically focusing in on drug development. So can you give a little bit more overview on that session specifically and what clinicians can expect to learn about potential new drugs or new treatments in the pipeline?
So we do have talks and industry-sponsored symposia on new drugs and drug development throughout the whole forum, actually. So not just specifically targeted to one session, as this is really a topic that feeds into all of our different concepts of MS, is how we can better understand MS and develop new drugs to target these different aspects. So, of course, BTK inhibitors are a very hot topic right now, and so we have some exciting information on paramagnetic rim lesions as potential biomarkers for disability in the tolebrutinib phase 3 trials. And we also have an industry-sponsored symposia specifically on BTKIs as well. So we're still trying to understand, how these work, how effective they are, the differences between them, and how exactly they're targeting different aspects of MS pathology. So that'll be quite exciting. We have continued work or presentations on ocrelizumab. So although, fairly recently approved, and we're still trying to understand what it's doing exactly. So we're going to be hearing about what ocrelizumab does to pearls, these paramagnetic rim lesions, which is quite an important feature of MS progression. And we're also going to hear about recent phase 3 results where ocrelizumab was looked at for this impact on cortical lesions in primary progressive MS. So I think this is a really exciting angle too, because cortical lesions have historically been more understudied, but we think they have really important impacts on MS progression. In terms of very new things that are more kind of at the border of eventually moving into therapies, we do have a little bit on CAR T cells. There's an industry-sponsored symposium on CAR T cells, and we also have a preclinical CAR T cell talk in the Young Investigator Symposium. So I think this is an area that we're going to hear a lot more about in the next coming years, and it seems like a very exciting approach that we can kind of steal from other conditions. And one thing I did want to note is on the preclinical side, but I think has a very high potential for moving into the clinical side fairly quickly, is that we have a really interesting talk on neuromodulation to improve remyelination. So as you know, remyelination therapies are lacking. We don't have any approved therapies right now, even ones that are further along in clinical trials. We're still trying to figure out if they're really, the most appropriate ones to use based on side effects, etc. And so what's exciting about this talk is that it's using vagus nerve stimulation to promote remyelination, and the preclinical data looks really exciting. And why this is exciting for MS is that this is something that's been used in stroke therapy and then also for depression. And so something that we can easily kind of transfer over from treatment from other conditions is something that I think is exciting because it moves us into the clinic a lot faster.
Thank you again for your time. Last question for you, seriously, thank you again for all of this. Last question is, what is different about this year's meeting in comparison to some of the previously completed meetings? Just how does this one differ from what we've seen in the past?
Yeah, so what you'll see in this meeting is that we have a big focus on big data. So these omics approaches, and this is something that's now been applied to, in the clinic and in preclinical models. You'll see it peppered throughout the entire forum. This is really highlighting the kind of advancement that we've made technologically to be able to really ask big picture, unbiased questions to better understand what's going on with MS, how we can use this information to understand pathology, to understand risk, to understand, progression. And so you're going to see a lot of that really as a focus throughout the whole forum. And another thing I'd like to note is that we wanted to make sure that we had a lot of fresh perspectives at this meeting. So the majority of our speakers have never spoken at ACTRIMS before. It might be a little bit of a surprise. We do have a lot of big names in there, but surprisingly, had not spoken at this meeting before. So we're hoping that with all of these fresh faces and ideas that we're going to learn a lot about new concepts that we hadn't heard about before in MS research and in the clinic.
Thanks for listening to this episode of the Neurology Live Mind Moments podcast. To support the show, be sure to rate, review, and subscribe wherever you listen to podcasts. And as always, for more neurology news and expert-driven content, visit neurologylive.com.